Hey there, this is John Cummins and welcome to another edition of a health update. One of the things I'd like to discuss, and I'm in the practice lately of showing brand new people a couple of slides. First of all, from a preventive medicine viewpoint, what are we trying to achieve by coming to our practice, which is really a prevention focused practice, as you can understand. The second thing is it's a really interesting slide on cancer prevention. The reason I show it is it lists the most frequent cancer killers in terms of their magnitude, in terms of penetrance. But secondly, it then tells you how much can be prevented for certain cancers. For example, 90% of lung cancer can be prevented, and the major risk factors being not only smoking but certain occupations, exposure to radiation, etc. Breast cancer, you could probably stop 20 to 30% of it. Risk factors being obesity, alcohol, hormone replacement therapy. Bowel cancer, you could probably stop 20 to 30% of it. The risk factors being red meat more than 2 times a week in order of frequency, being overweight, low fibre diet, radiation, etc. But I think the interesting thing is that when you look at some cancers, for example prostate cancer, we don't have a lifestyle risk factor that we're aware of in 2023. With lymphoma, a disorder of the lymphatic system, we don't really know the risk factors. With brain tumours, occupational, so white collar workers can be high risk, but we don't really know. But we think that probably for about 40 to 50% of cancers, there are lifestyle interventions that we can do to minimise our risk. And the worst thing you can do from a health perspective is actually be a cigarette smoker. And we don't know about vapes yet, but I encourage people not even to socially smoke. Why would you take the risk? The second worst thing you can do is carry excess body weight. It's implicated in so many different cancers. But I don't think people understand how important, remaining reasonably lean is. The third most important thing you can do essentially is, have a low fruit and veg diet. And so we're always, almost banging on with people. Look, you've got to get your 5 cups of fruit and veg in a day, the 2 cups of, 2 pieces of fruit and 5 cups of vegetables and salads with a huge variety. And then the list goes down. But in the preventative things, in addition to those, there are things like inactivity. So if you're inactive, if you're sedentary, you're more at risk of cancer. There are specifically fibre in the diet. It's actually very hard to get 30 grams of fibre in your diet, and that's probably the first YouTube clip I started off this series with during COVID, is the challenge of getting 30 grams of fibre in. And there are other things as well. So you could argue, well, if we can stop 40% by doing the lifestyle things that we always coach ourselves and you to do, Mediterranean diet, exercise enough, what are the other 60%? Well, we're not sure yet. There are some of these seem to be sort of random bad luck cancers. Some seem to be genetically driven. And so, what I really wanted to say is, in addition to sensible cancer screening, as dictated by your age and your personal risk profile, for example, a genetic susceptibility, we really would impress upon you the importance of the other lifestyle measures, because they are, top 2, 3, 4 in terms of preventing, a whole variety of cancers. So, happy to field any questions from you, but it's a really interesting slide to show people and to understand. A lot of people ask me for copies of it, and certainly we're happy to send the slide to you as well. It's a public slide.